Our main condition I want to look at and discuss with you today, where this chair comes into it, is the motor neuron disease side of things. So this chair has been designed to be adjustable in a number of different ways without the need of tools and to just give a wide range of support to a range of conditions. We would say on average it suits about 80% of people that need a chair like this. Now what we have in this chair is we have got, I say 4 levels of adjustment. My manager would say 5. I'll let you decide on the last one yourselves. We have got depth adjustment. So at the back of this chair, we have the ability very quickly to take this pin out from the back, and we can then move this chair forward or back depending on what we need. I'll bring it round so you can hopefully see on the screen. It's not the easiest thing to spot, but by adjusting or pushing the chair forward and back, we can actually get that seat depth where we want it to be. Okay, so again, going back to Liana's presentation, we want to make sure we're getting the femur well and truly supported. This chair gives that ability very quickly. Also, what we've got here on this chair is the ability to adjust the seat width. We have up to 22 inches of seat width as standard, and you can go into about 15 inches in seat width if you need to bring it right in. So again, you've got the option here to adjust accordingly to what you would need in that respect. If I take the arm off completely, we then have the ability to adjust the seat height. Again, Liana, you've made this very easy for me. You can just basically pick whereabouts you want that arm height to be. Once you're happy with that and it's supporting the client's shoulders and giving them a good spread of pressure in the right place, you can set that up and lock that off. And once you've done that, you just tighten the screw underneath, out of the reach of everybody, and you're good to move on. I'll move this back up a bit higher for something to come in a moment. Right. The next thing we have our leg elevation here, and we also have the ability to adjust our foot plate height. So again, Liana mentioned it in her presentation, the need to make sure the feet are well supported, whether that's on the floor or on a foot plate. In the case of motor neuron disease, it is often the case you would be using a foot plate you'd be hoisting the patient in, and they would need that foot plate to support their feet. So you have that ability to do that there. If their feet weren't quite reaching within the range that we have, we do have the ability to add a supportive cushion over the top that fits in line and just gives that adequate support and comfort. So, if you've been counting with me, you'll have seen we've got the seat depth, we've got the seat width, we've got the arm height, we've got the foot plate height. Those are my 4. Now my manager would say to me, yeah, but Ben, we can also adjust the back height. And he's right within a reason. I will have this conversation ongoing with him. By adjusting the cushion height, you can cushion round, you can get a couple of extra inches of height with the cushion there. Is it an adjustment? I don't know, but it is a very nice feature to have. Now, if you're looking at this and you're saying this is all very, very manual, you're absolutely right. A lot of the time what we would do is set and adjust the chair to the right dimensions of the patient and hand over and do any training for anybody that's caring and may need to adjust it at a later date. But most of those things you would do and set and they wouldn't need to touch. We do also have tilting space within this chair. Now that is a key feature for anybody that's sitting out for long periods of time. Again, we want to make sure that the person we're dealing with, why are they wanting to get in the chair? Most of the time for something like this one, and for motor neuron disease, they want the comfort, they want the quality of life, they want to be with their family, they need to eat, they want to relax and watch TV with everybody, they don't want to feel like just the other person in the room on their own, they want to be involved in what's going on around them. So again, as Liana said, it's very important that, and it's a big aspect of why this is so popular. So that function there, it is on manual on this particular chair, but you can power that. You can motorize every function on this chair. So you've got your tilting space, you've got your back angle as well, and you've got your leg elevation. All of those can be powered. So you can have the remote. The remotes are usually magnetized to the side, so there's no loops or anything else, which is a huge relief, because a lot of the time you work hard to get that person well and truly supported, pelvis nicely back in the chair, you know, everything supported, depth, width, all done nicely, and then they're trying to find the remote and they're leaning over. You don't want that, because then posturally you're in a bit of a pickle. So having a magnetized strip there just ensures that it's just a quick reach, they can find it and they can use it. Beyond that as well, we do have also the ability to link this up to eye gaze technology. Again, Liana mentioned it very briefly. As these types of conditions take hold, there's not the function physically to do anything. Often it's all through eye gaze and through technology, and that all plugs in and ties in very nicely with this chair. We can link that up and people can still function. They can tilt themselves back when they need to, they can bring themselves forward, they can still have a level of control over a condition that is quite obviously very difficult to deal with. Now, that's your basics within what you have here as standard. What I tend to find is that you obviously then need to adapt as things progress. And one of the biggest things is to support the head of the client, really. And so one of the things that I absolutely love and find really helpful is this particular head support here. Now, I don't know how close you can see this, but basically what we've got links all along the back here. It's attached to a bracket. So what we can do, we can slide this along either way if we need to. You can basically control how many links you have, where you want these all to rest and land, and basically we can really get into and support the client's head with this particular piece of kit. As well as that, what we can do is we can actually close it in or open it out depending on what we want. We can add links to it and we can leave links off. So if a patient is constantly leaning to this side, we can bring it right round here and then open up this side so we're not restricting that person's view. They're still able to see, function, kind of get you know, some sort of support there. We can add padding inside if we need to. There's a lot of things we can do with this, but ultimately this just helps to control that, especially if you've got eye gazes in the situation. We want to make sure they can access that at all times. This just ensures that we're keeping that head well and truly supported. There are a number of other things that we might need. You might need to increase, as things progress, you might need to increase the support that we put around the trunk of the patient. So having a thoracic lateral might be something we need to introduce, which you can add on here quite easily. We might want to change the cushion. We might want to have a bit more of a shaped cushion that's just lending a bit more support to the pelvis. There's a whole host of extra bits and pieces that you may require. We might need chest harnesses, we might need other things. Now, again, for me, it's about understanding, as Liana said as well, it's understanding the situation, understanding what are they needing it for. Of those 6 people that I mentioned before, one of the chaps that I was dealing with, he just wanted to sit with his family and watch movies with them. They had movie nights and that's what he wanted to do. And so there wasn't so much all the extra support. He did need it to be powered so he could change anything if he needed to, but the main thing he wanted was to just sit comfortably with his family. And so what they did, they bought a suite of sofas that looked very similar to this chair, had one either side, him in the middle, and he was able to tilt himself back, everything else. They took a picture of him there with his movie night, with his popcorn and all that sort of stuff, and just enjoying being out of his bed and actually in a chair that was comfortable, that was supportive, that was catching him in every place as it should. Final thing to mention on this, it is Dartex in the middle of the chair. What we do though, we would always in these instances look to provide a high cool gel into the seat cushion, which does kind of help combat the sweat that you can sometimes get from these chairs if people are naturally not good at regulating body temperature. You know, we can line it up with a cool gel, which kind of tackles that a little bit as well. But ultimately what this does is it gives freedom to change position frequently. It gives them the support they need, and you've got the peace of mind to know that if things change, because this is a progressive condition, you can adapt and add to. You're not having to buy another chair and hope it works and then buy another chair. You can tweak, adjust, add to. So it's keeping it cost effective, it's comfortable, it's reliable, it's supportive. And as I say, we had that incredible success rate with those 6 patients that this lady I was mentioning had struggled to seat for a good number of months before meeting us. So it does work, and this is one I would generally go for. I hope that makes sense, but if you've got any questions, I'll hand back over to Braden.